So hello and thank you to everyone for joining our webinar today. I'm going to give Mayuri a chance to introduce herself, and then I'll introduce myself. But we're really excited to have you guys here today. We have our Senior Product Manager, Mayuri, here to talk about our newest EHR integration with Greenway Health. So just as some general housekeeping items, this webinar is going to be recorded. And we'll go ahead and send that out when we finish today, either tonight or tomorrow. And then if anyone, again, has any questions, use that Q&A button at the bottom of your screen, and we will be sure to get to those. So Mayuri, I'll go ahead and let you introduce yourself.
Yeah. Hi, everyone. Great to see you all on here. I'm Mayuri, Senior Product Manager here at Klara. I work on a wide variety of products here and also this Greenway integration, which we're very excited to show you. So, we'll talk throughout the course of this webinar, but I just wanted to give you a quick introduction.
Awesome. Thank you so much. And I am Francesca Belmer. I head up product marketing here at Klara. And I'll be your primary moderator for today's webinar. And I'll go through kind of our agenda just really quick. So we have a 30-minute webinar today. We'll be spending the first 20 minutes discussing communication challenges that medical practices are facing today, and the automation solutions that solve these challenges. And obviously, we're going to be reviewing our Greenway Energy integration that we have. So throughout each of the sections you see here, Mayuri will be sharing some customer insights that relate to each topic. And then for the last 10 minutes, we'll do just a super brief Q&A and get any of those questions that you have answered. But let's kick off. So for first kind of look at some of the top communication challenges that the healthcare industry is experiencing today and how they affect patient access. So as you can see, when it comes to patient complaints in healthcare, you'll see that only 4% of patient complaints are actually about clinical care, and that 96% are actually about customer service and communication overall. Now, why is that true? Because I think we all know, because we're all also patients ourselves, communication in healthcare is broken today. And there's so many steps involved in the patient journey, from booking an appointment to getting pre-visit instructions, submitting your insurance information. The list really just kind of keeps going on and on. And with all of those touch points, there's a lot of room for error, especially when that communication takes place through a lot of back and forth over phone calls. Now, to dive deeper into the issue of phones for practices, you'll see here that 13% of calls in healthcare, they are abandoned. And then 34% of calls are just missed entirely. Of those missed calls, only 85% of patients don't leave a voicemail. So that's just, patients that are kind of lost, and they're probably not gonna call back. Now then, Mayuri, I've been chatting with these people for a while. I'd love to hand the mic over to you. What are some of the challenges that we've heard from customers that they've experienced prior to using Klara?
Yeah, absolutely. I'd love to kind of put it in perspective for you in, what practices are really experiencing today and what we've been talking to them about a lot. One of our practices really experienced a lot of exponential business growth, and this caused their inbound phone volume to completely explode. And you can imagine, as a result of this, patients complained about being on hold. Oftentimes the calls were abandoned, no one really picked up. So that is kind of one of the key issues that a lot of our practices come and complain to us about, especially in this area where they are, going through this great phase of growth. You also experience growing pains like that. Other practices, they continue to echo that their phones are really overloaded throughout the day, and the phone system also frequently drops their calls. Sometimes the patient hold times can be 20, 30 minutes, even an hour. And that's just not the type of patient experience that you'd want to deliver to your patients at the end of the day. We've been talking about, of course, phone volume challenges, but there's also a lot of work that staff has to do manually. And we all are, acutely aware of the staffing shortages that we're having right now in this industry as well. So, one of our practices, their staff was spending hours doing manual outreach per appointment, trying to reduce their no-shows, trying to get patients to come to these appointments. And oftentimes that takes hours out of a staff member's day to do that. And then when patients really didn't complete that patient portal self check-in or that check-in through the EHR, staff would again have to spend that time following up with patients pre-appointment to try to get that information. And then speaking of kind of this portal, idea, something that some practices have been using, the portal adoption has unfortunately been quite low. So, patients are unable or unwilling to use the EHR patient portals. Sometimes the enrollment is less than 10%. That's what we've heard from one of our practices as well. So again, along with, that wasting of time, it's almost using a tool in which patients aren't really using it either to try to reduce that time that staff is spending on the phone, trying to get a hold of the patients, or really completing those pre-appointment workflows. So all in all, kind of those all not only impact patient experience, but also staff experience, and really making sure that you're more efficient as a practice.
Yeah, absolutely. I think probably everyone in our audience can relate to those issues to some degree. But let's move into ways that automation can help with workflows and routine communication, and some of the benefits that we can see there. So like we've mentioned before, there are so many steps in the patient journey, from pre-visit to post-visit, and each step during these stages takes time from your staff to address, and takes time away from focusing on the actual patient care itself. Now, the research that we've seen, it actually shows that 50% of physicians' time is spent on paperwork, and only 27% of their time is spent on actual patient care, which is super frustrating, as I'm sure a lot of you on the call realize, because physicians became physicians to help patients, not to spend time doing paperwork. And not to mention, it also costs an average of $50,000 a year for a practice. So nobody wants to deal with that. So deal with that. So you're probably asking yourself, how do I fix this issue of wasted time? And the answer is pretty simple, we think, and that's automating the routine tasks that take up the most of that time. And with a solution like Klara, you're able to do that kind of all just while maintaining that personal level of care. So a lot of people usually think, automation means that you're removing that personal level of care, and we're here to kind of show you and explain how the two and two can actually go hand in hand. You can save time and still increase your patient experience and improve that overall. So one of the ways that you can automate throughout this entire patient journey is an example here of a pre-visit example. So you could automate a pre-visit communication without doing any manual outreach, none of the manual work. So 7 days before a visit, a patient could get a text with an appointment reminder, which is a proven way to decrease appointment no-shows. And then 2 days before the visit, you could have an automated message go out to that patient with a link to submit their insurance information, complete different forms and any other necessary information, which is all HIPAA compliant, of course. And then, maybe on the day before the visit, the patient can get another reminder that includes instructions for their visit so that they know what to expect. So setting expectations for patients is super important. And as you can see, automating it in one patient workflow allows a practice to, both save time that would otherwise be spent playing phone tag, like kind of that continuous loop of back and forth. They call in, they leave a voicemail because the line's busy. You call them back, they're at work, so they don't answer. Everyone knows the cycle and is familiar with that. You can also reduce in-office waiting times at the appointment, which allows the patient to complete pre-visit information, and most importantly, ensure that the patient actually shows up to that appointment. So well, this is just one example. You can imagine, automating multiple touch points throughout the entire patient journey, which allows for a streamlined patient experience that your patients will love. That's what we hear from the patients that use Klara through some of our customers. And instead of getting lost in a jumbled mess of phone calls and voicemails, the journey then becomes, super seamless and ensures that no information or patient gets lost in communication. And even better, when you're able to sync that communication with your EHR, like Klara does with Greenway and many other EHRs, you can make sure your staff has access to all the information when they need it. So it's always right there. Now, Mayuri, do you have any examples of how customers have streamlined communication through Klara?
Yeah, absolutely. I'd love to share that. So, for our customers, really what they take advantage of through our integrations are, our automation functionality, which again helps them respond to patients faster, sending pre and post appointment instructions, directly to the patient reliably, so that that the patients are being reached out to, and for example, for this particular appointment type, I need to send these specific pre-visit instructions. You can all kind of customize that with the integration as well. And it also helps you interact more conveniently with patients right through Klara. You can use that interface to communicate back and forth with the patients. And like Francesca mentioned, get rid of that phone tag that we all don't want to do. And the kind of the added benefit is that it does get stored in the EHR. So let's look at some of the results that kind of practices have seen through streamlining these workflows. For one of our practices, through automated appointment reminders, they were able to cut no-shows by 38%. That's really awesome. All of that, phone tag, we cut that out. All of the manual follow-up that you have to do, we cut that out. And really the patients get the message, and you can, increase the number of patients that actually show up to your appointments, which is what matters, right? You want to spend that time with your patients. It also resulted in them recovering over $3 million in revenue that they would have lost otherwise through these no-shows. One of our customers uses these automations to send intake requests. Like I mentioned, you can customize those forms, ask them exactly what they need to do or what the doctor needs from them in order to prepare for the visit. That way everyone's prepared, and now patients potentially have to wait in the waiting room for less time. So one of our practices saw that patients needed to spend 25 fewer minutes in the waiting room, which again, it makes for more productive staff. It makes for less wasted time as you're kind of trying to shuffle around, try to figure out what this patient has, doesn't have, what kind of paperwork is done, isn't done. And again, all of that is in the EHR as well. And then finally, we talked earlier about, inbound phone calls increasing. You tend to have this huge phone problem where patients aren't really able to get a hold of your practices. One of our practices saw a 40% reduction in the time that patients actually had to wait to get an answer from staff. And that actually freed almost 5 employees from actually answering the phones all day, kind of juggling answering phones in between actually doing their 3 full-time jobs on top of that, I bet. So those are just some of the ways that streamlining these workflows really can impact some of the problems that we spoke about earlier.
That's awesome. Thank you for sharing that. And now we want to quickly jump, since we only had 30 minutes for this webinar, quickly jump into a look at our Klara and Greenway integration, because I know that's why people are here and excited. So we'll go ahead and check that out. One of the things that Klara is able to do through our rules system, which we call Klara Assistant, is mimic the way that Greenway Energy practices have their internal workflows and processes set up. We can mimic that same process in Klara. So all of the automation that we've talked about, that's your day-to-day that you're doing anyway. Let our rules automation, let Klara Assistant do that for you. And what you'll find there is that every benefit we've covered today is possible with our Greenway Energy integration. And some of those benefits are really that all of your patients will be synced into Klara automatically and coming super soon. We're going to be able to export a lot of that critical information automatically or manually if you'd like back into your Greenway Energy EHR. We'll be able to collect all of that paperwork quickly and digitally prior to the visit. And then again, just kind of reiterating, automating those pre and post visit instructions, customized by appointment types, easily engaging with no-shows. That's a huge, revenue gain there. So any kind of no-show appointment that might take place, we can immediately send that patient a note, like a little text message, and be like, hey, like we see that you didn't show up to your appointment. Please reach out to us to reschedule another one and get them back on the books pretty seamlessly. And then patient retention. A lot of patients today, they drop off because they feel like they're not getting the level of care they deserve and expect at this point, when there's no outreach and follow-up of just like a simple text message checking how they're doing after they had, a plastic surgery appointment, something like that. So really increasing that patient retention with custom appointment follow-up messages adds that personal level of care, again, even though all of this can be automated. So as Mayuri, as our senior product manager, what are some of your favorite features of this integration, and maybe just Klara overall?
Yeah, to be honest, it's hard to choose, but if I had to pick one, it would be the fact that we can really increase patient access to healthcare by unifying all these channels of communication. Klara is really the communication tool. We want to take your communication from, if you're coming through the website, if you're coming through and texting us through SMS, if you're calling us and leaving a voicemail, we want to put that into Klara so we can really create that one, unified communication thread between you and the patient. And the kind of added benefit with this integration is the fact that we can do so many seamless workflows on top of this communication that we can build with you and the patient. That connection is the most important thing. So it really goes into this patient chat. You can see it, they can see it. And then you can build on top of it with all of these, pre-post appointment flows that we've been talking about.
Awesome. Yeah, it's also one of my favorites as well. So, no matter how, the patient reaches out, they are centralized within Klara, and, for Greenway Energy specifically, it's a really powerful integration. We're excited to roll it out. I know it's pretty brand new. It, just got released a few weeks ago, and we're still adding functionality today, which is also exciting. So again, automating communication across the entire care journey for your patients. These are all of the benefits. And I don't want to just read off a slide to you guys. You can see it here, but these are all the things that you'll be able to do, and you'll notice that all of that is automated. So again, decreasing that manual work and really getting time back to you and your staff so that they can focus on that patient care, and instead of having to deal with paperwork and the phone calls and all of these things that we're all very familiar with. So Mayuri, just to kind of wrap things up before we kind of go into our Q&A section, can you tell us about some of the recent customer benefits that you've heard about, so that our Greenway Energy practices know what they can expect, once they do this integration with Greenway and Klara?
Yeah, absolutely. One thing that we've been really hitting home on this webinar is the staffing shortage, and that's kind of really important to us to help you through this time. And one of our practices saved up to 3 hours per staff per day. Just through these automations, reducing that manual work. And that's a prime example of something that, as soon as you get set up with the Greenway integration, you can start seeing that benefit almost immediately. Here's another feature that we didn't really talk as in depth about, that I'd love to cover with you all even more later, but improving your online reviews, right? We have this ability to automatically send patients a review request after they complete an appointment. How did you feel about your appointment? How was it? And how was your experience? And then allow them to leave a review on, let's say, Yelp or Google. And so this has become increasingly important as patients are choosing where they want to get their care. So you want to be able to get more of those online review ratings, and they were able to increase the number of reviews that they got just through this automation in the first month that they were using it. And of course, the ultimate goal here is a fantastic patient experience. So one of our practices said 10 out of 10 patients really recommended and enjoyed their experience through Klara, to be able to get in contact with their practice so seamlessly.
Awesome. So I know we went through a lot in a very short amount of time. This is a nice and short webinar, but we do definitely want to open things up for Q&A. So I see that we already have a couple questions in the chat here, so I can go ahead and answer those live for you. And if anybody else has any additional questions, by all means, use that Q&A button at the bottom of your screen there and enter those questions in. But One is, what is the pricing for this integration? Very common question that we get on any webinar, and pricing is variable, right? So it's depending on, how many providers you have. So if you are specifically interested, feel free to reach out. I know who asked this question, so we'll go ahead and have a sales rep reach out to you, so we can make sure that we can get that quote over to you as soon as possible. Let's see here. Another one. Okay, so one of the slides said that exporting to the EHR is coming soon. When will that be? Mayuri, do you want to take that one?
Yeah, sure. We will have export ready by the end of this month. So the end of March, we're hoping to have export ready for you with the Greenway integration.
Awesome. Cool. So like I said, we just rolled out this integration, a couple weeks ago, and we're already going to have some more functionality coming out by the end of this month. So that's cool. Let's see here. Like another last question is how long does it take to get up and running with this? So I'll field that one. We have an amazing customer success team that has a whole implementation team that is ready to get you guys going with this. On average, depending on like base Klara functionality, we can get this going in, well below industry standard times. It's like, I think it's like 4 hours of your time total can get you up and running with like our core communication functionality. And then for the integration itself, usually takes a little bit longer than that. So at this point, like, a couple of weeks, it depends on kind of, what the implementation queue is, but usually, if this is a really, really big need for any practice right now, like you let us know, and our team is always willing to jump in and help. So generally, again, pretty quick there. But it looks like that was our last question. I'll kind of open it up again just to see if anybody has anything additional that they'd like to check up on. But otherwise we'll be at the end here. So I just want to say a big thank you to Mayuri for a great discussion. She's our awesome senior product manager, and really kind of the brains behind our Klara product. But I'd also like to say thank you for everyone in attendance here for making this webinar a success. Thank you for your contributions in the chat. And if you're interested in contacting us, you can go ahead and send us an email at the address listed right there in the corner, hello@klara.com. And if there are no other questions, thank you for joining our quick and fast webinar here. And I hope that everyone has a great day.